I call the member for Hasluck.
Thank you, Deputy Speaker. I rise to speak on the diabetes motion. Diabetes mellitus currently represents one of the most challenging public health problems of the 21st century. There are over 1.5 million Australians with diabetes, including those who are undiagnosed. Diabetes is a chronic condition marked by high levels of glucose in the blood, and this condition can be caused by the inability to produce insulin, a hormone produced by the pancreas to control blood glucose levels, or by the body not being able to use insulin effectively, or a combination. Over time, the high blood glucose levels are associated with complications such as cardiovascular disease, kidney disease, eye disease, neuropathy and foot conditions. Diabetes in its various forms places a significant burden on individuals and their families as well as the health system. The most common forms are type 1 diabetes and type 2 diabetes and gestational diabetes. Even within each type of diabetes, there are differences between individuals in what causes diabetes and the course in the disease. While lifestyle factors play an important role in preventing type 2 diabetes and managing existing diabetes, the mechanisms are complex and not completely understood. Genetic factors and environmental influences are also important, particularly during gestation and early childhood. A major goal of diabetes management is to prevent progression to complications. Depending on the nature of each individual's condition, diabetes may be managed with insulin injections, oral medication, and/or diet and exercise. It's interesting that when I look at the data for my own electorate of Hasluck, what I see is some very interesting comparisons. The total number of Australians that have registered with having diabetes is 1,093,125, and in the seat of Hasluck, 8,070. If we look at it by rate per 100,000, Australia is 4,725 compared to my electorate, where it is 4,951, so it's slightly higher than the Australian average. In my electorate for type 2, 90.1% have type 2 diabetes compared to the Australian average of 86.3, and for type 1, 7.5 compared to the Australian average of 10.9. For gestational, we are slightly better off at 1.8 compared to the Australian figure of 2.3. The International Diabetes Federation estimates that in 2013 there were 382 million people worldwide living with diabetes. In 2011 to 12, based on results from biomedical tests among Australian adults 18 years and over, diabetes prevalence was 5%. This comprised just over 4% with known diabetes and around 1% of adults who were newly diagnosed with diabetes. This equates to about 999,000 Australians living with diabetes in that period from 2011 to 2012. For the same period, it was estimated that an additional 3.1% of Australian adults aged 18 and over had impaired fasting glucose levels, indicating they were at high risk of developing type 2 diabetes. This means that overall, around 8% of Australians either had diabetes or at risk of developing it. Another study using different methodology with additional testing, AusDiab 2000, estimated that 16.3% of Australian adults aged 25 and over had pre-diabetes. Diabetes prevalence, based on self-reports from the Australian Health Surveys, doubled between 1989 and 1990 and 2004 to 5. From 2007 to 08 to the latest data from 2011 to 2012, the rate of self-reported known diabetes has been stable at around 4%. Type 1 diabetes, which commonly emerges in childhood, is an autoimmune disease and accounts for 1 in every 10 cases of diabetes. Gestational diabetes mellitus is estimated to affect women in more than 5% of Australian pregnancies each year and is related to the complex interplay of hormones during pregnancy. More than 8 in 10 in every 10 cases of diabetes are type 2 diabetes, which may be prevented or delayed through adequate physical activity, adhering to an appropriate diet and maintaining a healthy weight. Increasing age is also a risk factor. Diabetes, particularly type 2, is 3 to 4 times more common in Aboriginal and Torres Strait Islander populations, with rates of hospitalisation with diabetes being 4 times higher for Indigenous Australians than the general population. In 2011, diabetes was the second leading underlying cause of death in Indigenous Australians. The rate of death from diabetes in the Indigenous population was over 6 times the rate for non-Indigenous Australians. In conjunction with the World Diabetes Congress, the International Parliamentarians held a Parliamentary Champions for Diabetes Forum and established the Parliamentarians for Diabetes Global Network, and at which Minister Dutton gave a keynote address. I was in attendance and had the privilege of meeting parliamentarians from across the globe who had a strong interest in reducing the levels and impact of diabetes within their communities. The network is committed to working across parliaments to ensure diabetes is high on the political agenda in every country. They want to see more preventative work and to ensure that the early diagnosis, management and access to adequate care, treatment and medicines is available for all those living with diabetes. The Honourable Judy Moylan, who originally established Australia's Federal Parliamentary Diabetes Support Group in 2000 and served as the chair of this group until her retirement in 2013, is the global coordinator for the Parliamentarians for Diabetes Global Network. The forum endorsed a Melbourne Declaration on Diabetes which recognises that Parliamentarians for Diabetes Global Network will exchange policy views and practical ideas for prevention and management of diabetes, encourage all governments to acknowledge that diabetes is a national health priority that requires a comprehensive action plan leading to action and aims to improve health outcomes for people with diabetes, stop discrimination towards people with diabetes and prevent the development of type 2. The Coalition Government has committed to developing a new national diabetes strategy to inform how existing resources can be better coordinated and targeted across all levels of government, and to prioritise the national response and existing resources through an emphasis on prevention, early diagnosis, intervention, management and treatment, including the role of primary care. The government has important roles in maintaining access to affordable, high-quality devices, medicines and services to support people with diabetes in self-management and treatment. The Australian Government provides support to people with diabetes through the National Diabetes Service Scheme, NDSS, the Pharmaceutical Benefits Scheme, PBS, the Insulin Pump Program, IPP and Medicare. The government also contributes to supporting research into the causes, effects, treatments and impacts and complications of diabetes. Developing a new national diabetes strategy provides a valuable opportunity to take stock of approaches to diabetes services and care, consider the role of governments and other stakeholders, look at where efforts and investments are currently being made and how well this matches needs, and then develop a vision for where we want to be in terms of prevention, detection, management and research efforts. Governments cannot solve the problems alone but need to act in collaboration with individuals, families, communities, healthcare services and industry. The government is establishing an advisory group to consider the evidence and consult with a wide range of stakeholders to inform the development of the National Diabetes Strategy. The first meeting was held on the 11th of February 2014 and was addressed by the Honourable Minister Dutton. The government has recently announced an election commitment to provide $35 million to support research into a cure for type 1 diabetes through the Juveniles Diabetes Research Foundation Clinical Research Network, and $1.4 million for subsidies for an additional 136 children under the Type 1 Diabetes Insulin Pump Program administered by the Juvenile Diabetes Research Foundation. Deputy Speaker, as chair of the group that the Honourable Judy Moylan led previously, I will continue the work that she was a strong advocate for. Certainly will be linking with state and territory parliaments to join other parliamentarians within our jurisdictions to focus on some key initiatives and issues that will make a difference for the future. Thank you, Deputy Speaker.
Hang on, Jill.
I move the motion related to diabetes in terms of in which it appears in the notice paper.
I thank the member for Hasluck.